Welcome to Harlow on Healthcare. I'm David Harlow, and I invite you to join me by my virtual hearth as I sit down with healthcare leaders to discuss building the future of healthcare. Today, my guest is Mitchell Goldburgh, Global Solutions Leader at NTT Data Services. Thank you, Mitchell, for joining us on Harlow on Healthcare.
Thank you, David.
We're here live at HIMSS 2018, and we are talking about so many interesting issues here all around the future of healthcare IT. I know that NTT is working on automation systems of various sorts, and I'm wondering if you could clue us in to what occupies your thinking these days. What's front and center for you?
So I think at the heart of automation and at the challenge of healthcare today is interoperability, is the foundation. Without a strong foundation of clean information, it's not hard. In fact, what you can get is errors from automation if you're not careful. So NTT has been focusing on tools for interoperability and for ensuring the timeliness of the delivery of information at the appropriate point of care. And not only at the appropriate point of care, but all the way through all of the people who are involved in delivering that care and managing the risk of care. So that's payors, providers, and ultimately, if you look at healthcare holistically, there's opportunities to impact the pharmaceutical adoption by providing interoperability, perhaps anonymized, the information in healthcare. So once you have interoperability, then it's understanding which tasks should take priority in automation. Is it the ability to ensure that patients are timely in following up on the appropriate health benefits? The whole integration of the Internet of Things changes the word of timeliness, changes the whole concept of timeliness, right, David? So we're integrating not only the gathering of different data points, but we're also integrating that into existing information systems, some of which are focused on inpatient for a much different purpose than the outpatient systems.
Sure, and now you're integrating a whole host of other data sources, I imagine, not just traditional clinical data. Is that correct, or are you focused more on the clinical data itself?
So the short answer is we're focusing much more than just clinical data. We're also focusing on the population health data and understanding, especially with the Internet of Things, the behavior of people. So you could say it's clinical data, but if people are sedentary in the long-term care, which is becoming a big focus now that the population is aging, it's important to understand, are they up and moving? What is their activity schedules? What could be gathered from monitoring systems, which generally are continuous monitoring environments. But we're also looking at one of the things that makes NTT stand out is we've been managing clinical imaging data now for over 17 years, from radiology, cardiology, oncology. Now we're expanding into dermatology and pathology. And so those types of images speak volumes versus a single discrete value, such as a blood gas level or a standard outcome.
Sure. So I'll put you on the spot and ask, in 25 words or less, how would you define population health?
In 25 words or less, I would define population health, and now I got 12 left. Population health is defined as a continuity of care that is managing the health before the incident versus treating the incident of care leading to patient health.
Great. So managing a broad context for a broad number of people, really.
I think that is true from the provider's perspective, maybe the insured in a shared risk context. But to me, as the patient, managing the population health means managing my health such that I am productive, healthy, and able to contribute and follow my own personal interests.
Sure. So you're putting the patient at the center. Do you feel that the automation tools of the company are promoting putting the patient at the center on behalf of providers and payers, other stakeholders in the system?
Well, I think NTT as a systems integrator is really looking at opportunities selectively for intellectual property that we develop ourselves, but more to integrate all of the tools that are out there. So from a product perspective, that's not really what NTT is about, right? By that same token, I think the focus on Fitbits and watches and the rise in gym memberships and the generation that's coming of age is very focused on the population health from the patient perspective. And integrating all of that information. Look at what Google and Apple and all of the other consumer devices are now doing to contribute to population health from the patient's perspective, right? Patients are becoming very sensitive to diet, the whole natural food area. So population health from both perspectives, right? From the payer-provider perspective, we have the promise or the promise that value-based care will come to be. I think it's there's a lot of value to the patient health that will come from that, but I still think that adoption is a ways off. There's still a lot of fee-for-service.
Right. There certainly is. As they say, the future is here, but it's not evenly distributed.
That's correct.
A lot of us are still living with fee-for-service medicine. So in the context of fee-for-service and moving to value-based care, I'm interested to explore how the automation tools that you're talking about enable payers and providers to help lower costs and improve care. And perhaps there are some concrete examples of that that you can put on the table for us.
Sure. So it's really interesting the way you phrased that, David, because our booth theme today is that we are focusing at today is now, right? So the opportunity to take advantage of automation is in its early stages of adoption, right? Examples of that, of automation and tools like analytic tools that help with productivity, which can lower cost, right? Include working with, in the case of medical images, working to automate and quantify measurements that would otherwise require interaction with clinical software for the radiologist. So while we're not replacing the radiologist with diagnostic reporting, what we are doing is helping their productivity by prioritizing urgent cases based on algorithms. We're also using the algorithms to look at the pixel data to understand if there are unreported or subtle diseases that are chronic, such as a fatty liver that's indicative of diabetes, or a vertebral fracture that's indicative of osteoporosis that are very subtle things to detect, and in a volume-based fee-for-service model may not get reported on. For example, only 20% of vertebral fractures ever get reported on, positive or negative, leaving 80% opportunity to detect early signs of osteoporosis.
Right. So, quick sidebar. When you're talking about radiology images, are you talking about images that have been reviewed by a human and tagged, or is there an algorithm that was developed with some tagged images and then that's applied to images in the workflow, in the clinical workflow?
So it's an interesting question. So what we're looking at is taking algorithms that have been trained. So it's machine learning, right, using neural networks that does both segmentation and then quantification. So the range of analytics that are on this show floor today range across the entire spectrum of full integration with external population health databases and EMRs, all the way down to the images. We're at the other extreme where we're just looking at the image data and really looking at where's the vertebrae, what are the measurements that I can make there. So it's a fundamental adoption tactic that we've taken. Let's start with the basics, contribute to the productivity and the population health by identifying things that go underreported, right, that may be asymptomatic, allow the radiologist to contribute to the population health, which they normally don't do today, by reporting to the primary care physician, and then by early identification, contribute to the cost savings and patient population health by putting them, for example, in a bone health program or a dietary program for diabetes, or in a cardiac program in the case of cardiac disease that may be detected.
So do you see a danger of overdiagnosis with these tools that are perhaps more sensitive? I'm thinking, in my own personal situation, sometimes my doctor will say, well, maybe you should get an MRI. And my reaction is, well, great. So you'll get an MRI and you'll see the decrepitude of my aging body from the inside. And that may or may not be related to my symptoms. Is there a danger of using too much imaging, of taking too many steps based on the images, or do you have confidence in the automation and in the knowledge that's encapsulated there that can say, well, for this kind of image, we don't need to treat. For that kind of image, yes, we do need to treat, or there's an opportunity for preventive care.
So I'm not trying to be funny, but I say yes to all of it. I think there is certainly just a human reaction that we're in data overload today, right? Just fundamental data overload. And so depending on the type of algorithm that you're looking at for automation, to prioritize this as a brain bleed and should be read ahead of the non-brain bleed, that's probably okay.
Yeah.
When the radiologist is making a judgment based on their personal experience of mild, severe, or normal, you're subject to underreporting as well as overreporting.
Of course.
AI is either going to be consistently wrong or consistently right. Right. The important thing is you have consistency, right? And I think you can tune that to your own clinical practice and judgment.
And there's a feedback loop with live clinicians as well.
That's
so
correct.
That can be fine-tuned
either
on a systems basis or on a location basis.
But I think with all automation, especially in the way that automation can be used, if you're looking at bedside monitoring with the AI, for example, the challenge that you have is you could have a lot of artificial alerts, right? And what you get is alert fatigue, right? And that's what you want to avoid, right? So I'm very sensitive to. It's a great question, but I think it's a matter of time and judgment that will prevent automation from being robotic medicine. The human will always be the element that makes that final judgment.
If you're just tuning in, this is Harlow on Healthcare, coming to you on Healthcare Now Radio, live from HIMSS 2018. I'm David Harlow, and my guest today is Mitchell Goldburgh at NTT Data Services. So we're talking about automation. We've been talking about radiology in particular, and we took a little detour down that path. And I'm wondering if we could get back to some other examples of automation in the clinical workflow that you have been working on.
So there are areas to obviously optimize coding. We have a business that helps the payer market, and so we're looking at ways to use data about the patient to help the payers understand their population risk, right? Stratification. Working with providers as part of NTT Data Services to help payers stratify their patient population and understand their risk so that they can better manage the budget and better reimburse the providers for the services they're providing to the patients. I think all of those, as we just mentioned, have the opportunity for fine-tuning. The more data points you have, the greater the analytics. But to your point, it could be an opportunity for overanalyzing, not understanding the sensitivity of not smoking for 7 years versus 9 years, for being a vegan versus a vegetarian, all of these being subtle changes. And let's face it, health is a very complex, your body and health in general is a very complex problem to solve. So taking a very high level, there's the financial aspect where the automation can help. There's the productivity of not only of the diagnostician, but the automation in scheduling resources. Where is the nearest available slot for me to have my procedure done? I think it's going to change healthcare and its cost models significantly, because now, as my friend's son applied to 7 colleges with 1 application online, my concierge service will allow me to say, my primary care physician said I needed to have a stress test. I plug it into my insurer portal. They will find the lowest cost provider and all of that automation, right, which may not be overly complex, but nonetheless, this automation will send me to what's the most important factor to me? Distance to drive to the test, price of the copay, is it a male or female technologist, whatever those parameters are. All of those things are going to impact healthcare. It's going to be a real change for our kids.
So I hear you describing a lot of different sorts of implementations, and I'm wondering if you could describe where, who are the end users when you're thinking about automation in healthcare. Are you thinking of end users as being clinicians, as being other folks in the healthcare workforce, as being patients, or all of the above? Are there different tools that you're building that are designed for different audiences or user groups?
So, David, that was a lot of questions. I think the important thing to understand is that NTT is uniquely involved in the payer side of the business. We are working with providers for patient engagement. We're working with physicians at the practice level, as well as physicians in the workflow of a clinical department. So, in a much different way in each one of those categories, automation that we are integrating, whether it be extracting data from natural language processing with some of our partners to help create opportunities to have insights into the data, versus better communicating with implementations of Salesforce and automation that can come from patient engagement with patient portals and telemedicine. All of those are opportunities to affect population health. NTT is all about learning about those opportunities. As a product company, you have a product and you're searching for a problem. The exciting thing for me about working at NTT is that we're a company that finds problems and goes and finds solutions to those problems. So it's not a product house in search of a problem. We're a consulting solutions integrator that brings solutions to solve a particular problem.
So I think that's a growing theme in the sector, in the marketplace, that we're moving past as a sector in general, the notion that everything is about a technical tool, but it's about a solution, as you articulate. It's a solution that involves both a technical tool and an approach.
Yeah, I think that may be true, but I think at HIMSS 2018, what you'll see is there are a lot of companies on the downstairs area, in the 10 by 10 areas, that are really entrepreneurial, really exciting. It makes HIMSS a great place to come to see what is cutting edge in reinventing some of what the larger companies have today. And healthcare today is a very slow-moving environment. In that context, I think there are technology opportunities that are downstairs that are looking to partner with companies like NTT to help us learn what's in the realm of possibility to help solve some of our customers' problems.
There's quite a range of approaches and opportunities,
Yep.
I would say. Every year we try to look for a sort of a theme of HIMSS and a sort of a theme for the industry. Is there a theme that you see the company or the industry needing to attack, or that you have approached? And we've been talking about automation. Is it automation in service of something in particular? Are there other trends that you see that we should be thinking about?
So this is the first day of HIMSS for me, so I'm a little challenged in understanding the whole holistic view of the show.
Sure.
Obviously, I think the theme at HIMSS drives a lot of what we all message at the show from a commercial standpoint, right? I think the challenge that healthcare is still struggling with today is population health, the technology, the absorption of the technology to address population health, right? Whether it be the massive integration of EMR and the regulatory requirements and reimbursement associated with the adoption of technology is probably the most punishing element in healthcare today. The democratization of healthcare on the other extreme, where, as we talked about moments ago, where now you are being empowered to find the nearest appointment and the leakage that can come with that. When I say leakage, I mean the patient care organization. You're now going out, as long as it's still under the covered health insurer, you can still go outside that provider. So that means that there's financial opportunities that are being missed that have to be associated with the return on the investment, right? It used to be a very simple model. And again, I apologize, but my background is in imaging. I'm going to buy a CT for $350,000. I know that CMS reimburses, therefore I need to do so many procedures in a day. Whether if you walk around the show or on this floor, there are themes about enterprise imaging and interoperability, and those are very hard things to create an ROI on, right? Even the adoption of an EMR, while it automates HIM in many ways, there's the scuttlebutt, if you will, right? Behind the scenes is all of the buttons that I'm clicking are now being done by a higher paid healthcare provider. And so where is the ROI in the adoption, exactly. In the adoption of all of that? And frankly, when you start to analyze some of this EMR data, you're finding that it's really to structure the data for analytics and that opportunity, but people are finding ways to bypass it because they find that if they click this button, it forces another 4 menus to pop up. So they're avoiding clicking that button and putting in free text comments. There's a phrase that I recently heard that really strikes home here, where it's the tyranny of convenience, right? It's not my phrase. There's been several papers published on it. But in healthcare, I think it's the tyranny of automation, right? I think there's an opportunity to become so reliant on data and automation with the expectation that it will give us more time, when in fact it's only going to create more opportunities. And you said, as you pointed out, may create opportunities for oversensitivity to the detection of disease and the treatment of care, and more concern about what you eat and don't eat, so that we're just going to fill that void that the automation is creating with more things to do to be healthier people.
Yes. Well, I hope we do it right.
Don't we both?
Mitchell, I would like to ask you as a final question, if you were to suddenly find yourself 5 years in the future, what is one thing about healthcare that you would expect or hope would be very different from what it is today?
That's a great question, David. I think access to the information that I need in order to determine how my care is delivered, not only in the metrics of the quality of the care that's delivered, but where institutions, because diseases are getting more specific, and I know this is a long answer, but let me just highlight a personal experience. A friend of mine has a rare form of cancer, and what's interesting about it is it's really hard to find where the number of procedures were highest in treating that form of cancer, right? In 5 years from now, I want to be able to say, it hurts when I do this. Who has seen the most number of cases, so I can contact that person and get the best advice, right? And that's what's missing in healthcare today. Not because I want to read another WebMD and think I have a disease every paragraph I read. That's not what I want. What I want is something that's objective, that gives me, because I'm in healthcare, maybe I'm a little bit of a snob, but I want to be able to say, this guy has seen a lot of this, Stephen Johnson's disease, or whatever it is that are rare, and I want to be able to go to him and get his opinion about my indications. And that's really hard to do today. There's data there, it's just not accessible to the patient. That's what I want to have in 5 years.
Great. That is something good to strive for. Unlocking the data, understanding the data. Thank you very much, Mitchell. It's been a pleasure speaking with you today.
Thank you for your time, David.
You have been listening to Harlow on Healthcare. Join us at healthcarenowradio.com. Let's continue the conversation on building the future of healthcare together at #HarlowOnHC. I'm David Harlow, keeping the fire going and holding a seat open for you. Until next time.